Health United States 2015 series presented an annual overview of national trends in health statistics. The report contains a chart book that assesses the nation's health by morbidity, incidence and prevalence, mortality, health risk factors, prevention, utilization and cost, access to healthcare, health insurance, and patients' healthcare satisfaction. While the report is quite informative, we need to ask ourselves, what practical purpose does it serve, and how does it help us improve the quality of healthcare delivery and lower its enormous cost? The results have been disappointing. The market demands more productive and cost-effective programs. So, let's see what constitutes a coordinated, effective population health management program. The answer is the concept of responsible care or holistic coaching. Responsible care is delivered by a cooperative and coordinated effort starting with the lowest resistance point of entry and moving up the healthcare delivery system according to the severity of the medical conditions. The holistic approach is a method of approaching a patient as a whole person that includes medical conditions as well as health risks, socioeconomic status, health acuity, health perceptions, etc. When we speak of holistic, we are referring to the whole person. In other words, their physical, mental, and spiritual internal environment. This is in comparison to holistic, which refers to alternative medicine and approaches to health and healing. There is some confusion to the two words holistic, and they are often used in an incorrect manner. The two words have very distinct meanings, though somewhat similar in definition. Holistic refers to the whole, a whole item or whole body of a person or thing. The word defines the consideration of the entire structure or makeup, which includes the body, mind, and the spirit in the case of a human being. The word holistic is connected to holism, which focuses on the total entity and the interdependence of the diverse parts of this totality. Holistic has to do with the healing systems that are considered alternative, like homeopathy and Ayurveda, that deal with the human body as an interconnected whole. The patient port of entry, other than emergencies, should start with a health advocate and move up the escalator according to the severity of the condition, to the appropriate specialties and subspecialties as necessary. At present, our port of entry starts at the top and trickles down to the bottom, which is inefficient and expensive. This trend must be reversed from bottom to top in order to facilitate efficiency and lower costs. Episodic care is delivered to a patient via provider encounter, which we refer to as a visit or an event. Most of the diseases that incur a majority of healthcare costs have inappropriate episodic care. However, if episodic care is combined with preventive care using risk analysis and scientific targeted screening, early intervention, and standardized treatment protocol, it becomes more effective and less costly. To achieve the greatest quality and efficiency, we need to combine reactive with proactive medicine. Today's consumer is more sophisticated and has higher expectations of his or her healthcare provider. The consumer is demanding comprehensive and sophisticated tools for health risks management, preemptive intervention, episodic care, medical data mining, and effective communication. This brings us to patient-centric healthcare. The schematic presented here demonstrates the structure of this concept. Patient-centric care and holistic care focuses on the patient, not on the diagnosis. Therefore, the hospitals, providers, and health management companies should work conjointly to assure the best, most effective healthcare delivery. Since healthcare is expensive, we must have coverage that ensures healthcare is accessible to all. Therefore, providers and preventive health services must work closely with the health plans and insurance institutions. The reality is, we need to drain the pre-disease pool in order to reduce the chronic disease pool and increase the healthy population pool. The reality is that 85% of healthcare costs come from 15% of the population, and 59% of last year's low-cost individuals will become this year's high-cost population.